What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far. If you had to take a test for any of the viruses, I hope you have tested negative. It is time now for the Wednesday edition of the Virus Update for Wednesday, June 25th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there, but not enough attention given to them. That's where I come into play. Want to stay informed? Subscribe down below. Give this video a thumbs up. Hit that notification bell and share this video with anyone you know. And of course, leave any thoughts or comments down below. Alrighty, we do have several news stories to take a look at today, and a bunch of other things, including a few more concerning wastewater sites that I have found today. So let's get right into it, shall we? Starting off today in Multnomah County, Oregon, where they are recording their first measles case of 2025. That's right, this is their first measles case of the year, and it sounds like this is an unvaccinated adult. We also have another first measles case of the year. North Carolina, this is in the Greensboro, North Carolina area. They are reporting their first measles case of the year as well. I'm not seeing if this is a vaccinated or unvaccinated. I want to assume it's unvaccinated because that's what the majority of these cases have been. But yes, it does look like it's a child that was traveling from another country where measles outbreaks have been reported. So yes, and they are urging all unvaccinated people for measles, get vaccinated for measles. Now, we can't confirm this now. Remember, Utah was starting to see measles? Well, guess what? All three confirmed measles cases in Utah were unvaccinated. Again, it's the unvaccinated population that's the problem. Some good news now. Yes, I always like to have a little bit of good news, and this just actually came up by surprise. Remember yesterday, we were waiting and waiting for Texas? Texas did finally update. Matter of fact, let's refresh this. Texas did finally update, and you can see here the number of cases for measles in Texas did not change. It's still 750 cases. Could they be missing cases? It's possible, but hey, let's take this tiny bit of good news. It looks to me like the Texas measles outbreak has significantly slowed down because the number of new cases, there's none in the new update, and this has been happening a couple times now. All right, in southern Illinois, they're reporting their first human case of West Nile virus found in southern Illinois. I'm assuming this is for the year, and this is not good, and they're saying it's the earliest onset of illness since 2016. Remember, it's only June. This illness, which often comes from mosquitoes, this is not something that usually picks up until we get into later into July and August, and here we are. It's happening early this year. Would not be surprised if some of the northeastern states in the United States start to report this as well, because we've had a lot of rain, though that has subsided for a little bit. Mosquitoes are a big issue. I know when I was at our place upstate, the mosquitoes were just driving me nuts. I didn't have any mosquito repellent on. Maybe I should have, because they were getting inside as well, which that is just adds to the misery. All right, moving on now to this, and kind of a different way of looking at India today. You know, usually I Google search India's COVID cases, and I usually click on the news button. I didn't have that clicked on. I had the dashboard, or I had, regular Google search clicked on, and take a look at this. I actually found India still has a dashboard. So maybe we'll use this from now on. No more of those Indian news sites that have, so many ads on there. And, if you put an ad blocker on, well, there goes half the news sites that we use for these videos. So can't do that because I've tried doing that, and it just leads to a whole bunch of error messages and problems. But India, active COVID cases, 3,797 have been reported there. So that is a number that does appear to be dropping at this time. That is some good news. All right, wanted to share this with you from Jammer. This is an account you see me talk about from time to time. There's several of them that I show here on the channel from time to time. This is one of them. And he posted this about brain fog. Now, this is just an excerpt from an article. Brain fog may gradually evolve into a slight memory problem, difficulty finding the right words for things, objects, situations, and then registering new information. We are referring to COVID here. A widely held notion is that SARS-2 activates our immune systems, causing an inflammatory response in the brain. And you may notice, for me, because I've had COVID twice, you may notice for me, you'll see brain fog pop up in some of these videos once in a while, where finding the right words for things. Yeah, have you ever noticed in my videos that happens sometimes? I think that's a part of brain fog, and sometimes it's much worse than what you see in the videos where I'll just pause like, what was I doing? It happens. It's a part of long COVID, and he did post a link to the full thing. The condition is also associated with daytime sleepiness, sluggishness, and slowness of thoughts. If somebody is asking you a question, you take a long time to figure it out and express it. Yeah, I've had that happen. So, yes, this is something that we need to keep our eyes on. There'll be a post on my site today, later this evening, with all the news stories used in today's update. And you can actually go to social media to see his thread, or you can just go to my website later on in the day, where I will have this included in that. All right, moving on to this bit of good news. Yes, I'm full of good news today. Well, some good news. Updated COVID vaccine reduces risk of severe illness and death, especially for high-risk adults. All right, take this information as you will. I know I get so many comments about, the vaccine's causing a problem, this is causing a problem. Okay, there's science that says otherwise. You may have saw some of it the other day. We had that whole comment issue. I think YouTube's having some sort of an issue with the whole way comments work. We had to actually turn off moderation the other day. Yeah, that was a disaster. Moderation's turned back on. All right, a new multi-state study led by the Centers for Disease Control talks about how there is some effectiveness in protection against XBB and JN.1. Now, you're probably saying, wait a second, XBB, that's an old variant. Yes, that one is an old variant. However, JN.1 is where some of the new subvariants stem back to. They come from JN.1. So, hey, this is some good news at this time. Of course, if you want to read this full thing, again, there will be a post on my site probably at some point this afternoon or evening. All right, a little bit more good news. Yeah, I can do that. Vermont Department of Health, COVID cases remain very low. No deaths have been reported. However, within this little bit of bad news, Norovirus is high in Montpelier. We'll take a look at that wastewater site. We actually have several wastewater sites to take a look at in a little bit. So, yes, COVID is not doing bad in Vermont. I think eventually that will change at some point this summer, maybe later in July or July going into August. I don't know. It's probably going to be post 4th of July at this rate, because I remember the Northeast usually rises later than the South. Northeast oftentimes is during back to school. However, when you see wastewater a little bit, yeah, we got to see a Northeast wastewater site too. All right, taking a look now at what is going on in Canada, skipping over to UK tab. That we will get an update on tomorrow. And, oh, look at this, new today. The viral wastewater activity level for COVID-19 in Canada is moderate. Flu A, Flu B, and RSV are all across the board low at this time. But hey, COVID once again, it's gone back to moderate up there. All right, air quality's not great. And to add to the misery of places where it is really hot, air quality is doing just that. Take a look in the east. Not great air qualities. And really, there's a lot of yellow all across the country. Maybe exceptions to the Four Corners region. Just a few spotty areas and maybe some of the Rocky Mountains. But even the West Coast. Yeah, yellows go right up into Idaho, Washington, Oregon, down into California. And then you got those oranges in the southeast. Not a great day for air quality. Not a great day for heat-related illnesses once again. We're not done with the news yet. One final news story today. Yes, 3 prospective recruits at a firefighting academy taken to hospital with heat-related illness. This happened in Massachusetts. This happened, it looks like it's happened today. 3 recruits at the Massachusetts Firefighting Academy were taken to the hospital Wednesday with heat-related illnesses, and they were taking part in recruit fitness orientation when they started to experience symptoms. And in this particular case, the show must go on because, let's face it, when firefighters respond to calls, no matter what the weather is, they got to respond to the call. So they respond to calls in this weather, which means they're not going to postpone training sessions for this. They can't, because why would they postpone training during very hot conditions when they become firefighters? They're just going to have to deal with these conditions. So, yeah, but this is not good. Water's a thing. I saw on the news yesterday, here locally, there was a fire in part of southeast Pennsylvania. I saw that they had to put rags on their head to cool off during fires. So, wet towels that they use around their head, their neck, that can help, but sometimes that is not good enough. All right, take a look at this. One last day of this extreme heat for portions of the Mid-Atlantic and the East. The South may stay hot for a while, but the temperatures near 100, that's it for them after today, at least for now. There may be more later in the summer, but this extreme heat, yeah, it's going to subside some. There may still be some hot weather tomorrow across, we'll say, south of Philadelphia, Washington, North Carolina down there. Yeah, you may be concerned again. And then on Friday, I think everyone will break from the heat, with exceptions to the southeastern states. You're accustomed to having a lot of 90-degree days at this time of year. All right, take a look at the breathing index. Yeah, it's really poor in the southeast. It's poor in portions of the Four Corners region and the Rocky Mountains. Really, anywhere where you saw that bad air quality on those maps, consider it to be poor breathing conditions in those areas. Tree pollen, that continues to look further north. Grass pollen continues to be an issue at this time. We can see it is very high across the Ohio Valley, Chicago area. Look at this, the West Coast, yeah, high there as well. Moving on to this now, Pinellas County, Florida, has been having some issues. So yesterday we talked about Australia, 10-hour waits to discharge for patients. Well, they're not dealing with 10-hour waits in Pinellas County, Florida, but what they are dealing with is a lot of ambulances in the red here, and also a ton of sick person calls. Let's count how many there are at this very moment. 1, 2, 3, 4, 5, 6, 7. Yeah, I mean, COVID is going up in Florida. It's heat-related illness season. It's the combination of things right now. And look at this. It just updated here. I think it's going even higher. So, yeah, a lot of calls and other things going on. Breathing problems as well. And it's starting to back up the emergency departments, which is why we're seeing these red. And look at this one. 35 minutes for this sick person call. In other words, 35 minutes. The ambulance is sitting there waiting to discharge the patient. And as you know, there may be other patients out there that are waiting for an ambulance to arrive, and the ambulance hasn't gotten there, so the ambulance from further away has to come because no one's available because they're stuck at the hospital waiting to discharge a patient. All right, now we got some really bad news. This is probably heat-related illness. Take a look at this. Yeah. Philadelphia, Monday. 1,013 EMS calls. Again, that's likely due to the heat-related illnesses. Tuesday was better, but not great. 902 EMS incidents, and I suspect today's going to be high as well. Again, I'm thinking heat-related illnesses is why this is so high. Doing a live look at Montgomery County, which has been busy all morning. For the longest time, they were near 19 calls. They were at 19 calls. Now it's down to 15, but still busy. Cardiac emergencies. You're seeing a bunch of things showing up here. Seizures, dizziness, respiratory emergencies. Hopefully Chester County is not too busy. And actually, no, not bad right now. Heart problems is showing up. Sick person, and a few other things. That's not bad considering how hot it is outside right now. I'm looking. It's 98 degrees here in Philadelphia right now. Take a look at this. EMS calls, or excuse me, hospitals right now, the emergency departments. And we can see here that, yeah, it's still busy. Not as busy as yesterday, but it's still busy. Wellspan, York, double trouble here. Behavioral health diversion and emergency department overcrowding. Stroudsburg, Pennsylvania, yeah, that's dealing with emergency department overcrowding. Taking a look at what is going on in New Jersey, we do have a couple of hospitals with problems. Hoboken University Medical Center, emergency department. Looks like there's an adult ED problem there. And it looks like Cooper University Hospital, full and total divert once again. Ocean University Hospital is also dealing with problems. Hey, we're starting to get closer to the Jersey Shore. It is that time of year. RWJBH University Hospital Hamilton, full and total divert for the next 4 hours. So some problems starting to show up in New Jersey. And let's see, did New York State update for today? If not, we can run with yesterday's numbers. Because New York State, believe it or not, is still not doing bad. And while we wait for that to come up, if it does come up, let's pause and take that hydration break. Water is the drink of choice today. Alrighty, there we go. Yeah, it's yesterday's number. 256 new cases. You can see here, it is trending down once again. Very good news. Hospitalizations, 252. And 27 in the ICU at this time. That is some fantastic news. Alright, let's take a look at emergency department visits diagnosed with COVID. And we're going to do all the available states. First off, nationally. Not dropping, but not rising either. I think eventually the next path is going to be, it starts to rise. Alabama's continuing to drop. Alaska at this time, it's starting to go up a little bit. Remember, these are people diagnosed with COVID showing up at the emergency department. Arizona, little rise at the end. Arkansas, little rise at the end. California has been rising slightly. That slowed a little bit. Colorado at this time, no real clear direction just yet. Same with Connecticut. Delaware, also no real clear direction. Looks like D.C., Washington, D.C., District of Columbia, starting to rise. Florida is definitely on its way up. Georgia is flat at this time. Guam, slight increase. Hawaii dropping some. That's good to see. Idaho is rising slightly. Illinois, no clear direction just yet. Same with Indiana. Iowa is still dropping slightly. Kansas, again, no clear direction there. Maybe it's going to start going up. I don't know. Kentucky's still dropping. Louisiana's starting to go up slightly. And I'm going to show you a wastewater site there in just a moment. Maine is dropping. Maryland was dropping some. Now is it going up slightly? I can't get a clear direction of that one either. Massachusetts is dropping slightly. Michigan's still dropping. Mississippi is dropping. Montana's starting to rise slightly. Nebraska, that's stable right now, we'll say. Nevada, also stable. Starting to see a rise in New Hampshire. New Jersey is dropping. New Mexico, maybe a slight rise at the end. New York, still dropping slightly, I'll say. North Carolina dropping slightly. North Dakota dropping slightly. Ohio is starting to level off, and your next movement may be upward. Oregon's starting to go up slightly. Pennsylvania is dropping. Rhode Island, after a rise, has dropped some. South Carolina starting to level off. South Dakota, it did go up slightly and then it leveled off once again. Tennessee still flat. Texas rising ever so slightly. Utah is dropping. Vermont. Now, when we look at Vermont here, you can see they did have a little bit of a rise recently. So that is something we will have to keep an eye on. Virginia looks like maybe at the end you're dropping slightly again. Washington has dropped slightly. And West Virginia is rising slightly. Also, we see Wisconsin rising slightly. Nothing out of Wyoming and any other state not mentioned just is not listed here. All right, I got to show you this in Florida. Take a look at this. Southwest Orange County, Florida. Wastewater for COVID. This orange one here. Yeah, it's just skyrocketing at this time, and I believe, isn't that, maybe that's not where Disney is. The point I'm trying to make is that it's really concerning. Also concerning, Norovirus is not doing well here. I'm hearing this year, Norovirus is a different variant, if that makes any sense. So that's interesting. Could be why some places are dealing with rises. Alrighty, let's get over to wastewater scan, because there's several things we want to take a look at here. First off, New Orleans. We can see here. Yeah, big rise for COVID at this time. That's concerning. Biggest rise they have seen since back in April when they had a spike. And HMPV, it's high. It's going up slightly. And also should mention, COVID is back to high at this wastewater site. And everything else at this time is fine. Although, Norovirus, it is rising slightly. Got to keep an eye on that. Seems to be several places for the summertime that is rising for Norovirus. The South region as a whole is high at this time. The West is in moderate for COVID at this time. Then we come up to the Northeast. Let's take a look at Montpelier, because we heard about the Norovirus issue there. Take a look at that. COVID may be trying to go up again. RSV still listed high, has dropped. And here's Norovirus. see it is having a slight increase at this time. Hey, no measles or mpox issues there. Now let's go up to Lewiston, Maine, and this one concerns me. It's not far from where I'm going in the second half of July. Remember, I've said this before. There are a lot of summer homes, camps, as they're called, lake houses, whatever you want to call them. They're actually called camps on lakes. You know, people own houses on lakes. They call them camps up there. That are not connected to the sewer systems. They have septic tanks. So that's not showing up here. So when you start to see a rise in an area like this, it starts to get concerning. And it's already listed high, and you can see it is clearly rising. It did rise before, and now it's rising once again. So that's something we have to continue to watch. And because of that being high, and because of all these moderate sites, well, the Northeast region as a whole has now gone up to moderate for COVID. So that's something we're watching. Hey, things are still good in the Midwest. And in fact, let's take a look at one of the Midwest wastewater sites. And yes, you will see Ann Arbor, Michigan for COVID is rising ever so slightly at this time. But again, at the moment, I'm not terribly concerned about that. And let's look at one other thing on this map. Let's go to nationwide. And let's just take a look. Are there any new detections of measles today? Well, we see the measles detection still showing up there in Sacramento. And we can see here, let's click on it. Also see in San Francisco, measles detection. Oh, yeah. Wow. So there's definitely a spread of measles going on in Sacramento. And take a look at this, San Francisco. Is this new? I don't think it is, but taking a look here. No, it may be new. See, there is still a detection of measles here as of June 21st. I believe that's new, so we'll be looking to see if there's any news stories that pop up for either of these. Alrighty, folks, that does it for the Wednesday edition of the Virus Update. If you enjoyed this update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. Ways to support the channel. Patreon. Super likes. Whatever you want to do. There's ways to support my work down below. And to those who did, I thank you very much. I will see everyone again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Wednesday afternoon. Thanks for watching.